Lieutenant Governor and I to walk through this 94-bed facility that was set up by Mike Lau and the folks from Cape Cod Healthcare, along with General Keefe and General Lau from the from the National Guard. Where is he? There he is. And I just want to say, first of all, when I said this to General Keefe on my way in, we are all incredibly grateful for the work that's been done by the National Guard across the Commonwealth since the beginning of this outbreak. When you call, they come, and they have been on the scene in a whole series of typical and many atypical scenarios and projects and missions since this all began, and I can't say enough good things about the work that they've been doing. The facility itself looks a lot like the field hospital that we toured at the DCU Center, and very similar to the one that I had a chance to take a look at the BCEC. And I say that because one of the things that makes this possible is the number of times that the Guard and FEMA and MEMA have worked to put these kinds of facilities up, not just here in Massachusetts, but all over the country and around the world. And it makes them very good at it. And this thing went from nothing to what it is now, fully outfitted and ready to go, 94-bed facility in about 6 days. Is that about right?
Yes, correct.
And Mike's also a terrific leader. We've talked a lot about testing. We've talked about how important that is. I do want to give you some updates on this. We think testing is a big part of identifying people who are dealing with COVID-19, but it's also part of then recognizing and identifying the people they've had close contact with, which is why we're working on putting up what I think will be one of the largest contact tracing programs anywhere in the country, because in the end, testing and tracing are a big part of how we actually push back over time against COVID-19. We continue to make a lot of progress on testing. You know, depending upon whose data you look at, we're either the third or fourth largest tester in the country, which is quite an accomplishment since we're certainly not the third or fourth largest state in the country. And we continue to make progress. As of yesterday, we've conducted about 122,000 tests, including 5,319 tests that were conducted yesterday alone. And we're now conducting testing at 28 sites statewide. And we continue to get more nimble and more creative with our testing as we go, as we talk to our colleagues in the healthcare community, and as we create new and different options to ensure that we're testing in the right places. Thanks to a lot of hard work and collaboration, we're now offering testing through mobile test units at nursing homes that's supported by the National Guard, at assisted living residents and Department of Developmental Services group homes, including the Rentham and Hogan sites, at Gillette Stadium and at the Big E for first responders, grocery store workers, and others, and at a CVS test site in Lowell where the public can make an appointment online. That's a rapid test system there. Can do up to 1,000 a day. And through mobile test kits that are supplied directly to long-term care facilities that have the capacity to actually do the tests on site so that they can do their own testing quickly. And we'll keep working to expand our testing capacity for more residents, especially in communities that have had severe outbreaks like Chelsea, where over the course of the weekend we expanded our testing by 4x. We continue to chase down PPE wherever we can, and through our COVID Command Center, over 3.3 million pieces of personal protective equipment have been distributed to hospitals, nursing homes, community health centers, public safety personnel, local boards of health, and state agencies. And that includes nearly 2 million gloves, over 720,000 masks, over 365,000 masks from the aircraft delivery, and over 167,000 gowns. Starting Sunday, the Command Center has started posting a daily inventory of PPE, sorted by types and where it's been distributed around the state. This will provide a regular update on where our PPE is going, what types of supplies are in use by our first responders and frontline healthcare workers as we continue to navigate this pandemic. As everybody knows, we've also been modeling where and when we think the Commonwealth should expect to see a surge in cases, which has helped us put together our projections on how many beds we expect to need and where they need to be located. Secretary Sutters and our COVID Command Center have been working closely with the hospital community, some cases every day, throughout Massachusetts to understand their capacity and at the same time also what's going on day to day there. And they're now posting a daily dashboard to update the public on hospital capacity around the state. This will be posted starting today at about 4 p.m. It will include an estimated inventory of how many hospital beds are available and where, including ICU, acute, and field hospital beds. For hospital capacity, as of Sunday night, we're up to about 15,900 usable beds statewide. Roughly 5,000 of those beds are available for non-ICU or acute care. Roughly 2,000 of those beds are available for ICU care, and nearly 1,000 beds are available in our field hospitals for patients who need it. In short, we have about half of our beds available statewide right now for different levels of care. As part of our strategy to increase bed capacity in all corners of the Commonwealth, we've been pursuing the construction of 5 field medical hospitals in different regions. The beds in these facilities will serve as an alternative care option for medical professionals to treat patients, especially those who need less intensive care. Each field hospital has a local healthcare partner, and that's why we're here today with Mike Lau and the folks from Cape Cod Healthcare, because they are the partner and sort of the lead dog on this site. Cape Cod Hospital has been a terrific player and a terrific partner in this, and Mike will have an opportunity to speak in more detail about the work they've done in a minute. The Lieutenant Governor and I have toured the hospital at the DCU Center in Worcester, which opened its doors to patients last week. I took a walk through the BCEC last week, and they started accepting patients last Friday. We're also on track to open 2 additional field hospitals, one in the Merrimack Valley and one on the South Coast. In Lowell, we're in the process of opening up a field hospital at the Umass Lowell Recreation Center in partnership with Lowell General Hospital next Monday. That facility will have 95 beds. And on the South Coast, we're finishing work this week on a 140-bed field hospital at Umass Dartmouth. This site here at Joint Base Cape Cod, as I said earlier, will house 94 beds, and we'll start taking patients on Monday. The site would not have been possible without the terrific work of the National Guard, Cape Cod Healthcare, MEMA, and the folks in our command center.